Start now. Scenario IV. So I'm going to take this in, wash my hands, introduce myself to the patient. Hi there, I'm Lara, I'm your nursing student. Just wanted to verify your name here. Could you please tell me your name? So Ralph Sec, and your birth date, please. It's not on there. But identifying your birth date. Okay. Perfect. I just want to do some assessments, so I would assess his hydration by doing skin turgor. If it was less than 2 seconds, it would indicate that he is well hydrated. Looking for mucous membranes. Has he been vomiting? Had diarrhea? Those things. What has his intake been like? Because those are all things that contribute to hydration or dehydration. And I would also just explain what I'm doing. So we're going to start an IV infusion for you. The doctor has ordered to have you a little bit more hydrated, and just so you can feel a little bit better and help you heal, especially if you have gastroenteritis where he might be becoming a bit dehydrated. I'm going to go set it all up, and then I'll come back in here and set it up. Okay? Let's do it over here. Okay, I will come and do it in here. All right. Now I'm going to get all my supplies. So I want gloves.
So, drawing this portion will be taking place in the bedroom. So I'm just going to demonstrate how to go about drawing this up. Making sure that you have sterile technique. I will be drawing up the morphine first.
Yeah, you've got lots of time in the reflection room, so if you're, for the sake of time, if you don't want to do it right now, you can do it after.
Okay, so flick the tip of the ampule, making sure that all the air is at the top. So if you crack it off, you're not going to spray it everywhere. So, off. And you're going to use a filter tip needle for this.
All right. So just have all of my materials. What I just want to do is do my 7 checks with the saline solution. So looking against the doctor's orders, if it's the right solution, so NaCl, which it is normal saline, and then 0.9%, which is the right concentration. It's a 500 ml bag, so that's the right amount. It's the right time because it's saying to infuse it now. It's December 10th. Right reason for rehydration. I'm going to document it in the ins and outs and nursing notes. And it's for the right client, Ralph Sec. So everything here looks good. I'm just going to be also looking at this bag. I'm going to open it. For the expiry date, so it's not expired yet, which is good. I'm also just looking for the amount of condensation on the back. This kind of weird condensation, I don't know if you can see it, is kind of not the best, but I feel like it's just what we have in this scenario. But in real life, I don't know if I would use that. But yeah, just looking if I can read over there, if there's any precipitate, and just squeezing the bag to see if it's leaking, which it's not. I'm going to bring this in, or this. Maybe I'm going to bring this out here. I think that'll be easier for me. Just going to bring this back, Ralph Sec. Let's do it then. Alright. Just going to grab all my materials. So, bringing this in, the alcohol swabs, the saline lock, the clear link system, my label, which I'm going to sign, and when I start it, I'll put the date and hour, so I can just put the hours, so I'll put 11:30. So December 10th at 11:30, so that'll be December 11th at 11:30, that it will be done. All right. I'm gonna wash my hands. Oh. Bring my label in. That's gonna be for later. I'm just gonna set up. All right. Washing my hands when I come in, providing privacy. And I'm just gonna maybe roll this table in here with me so I'll have somewhere to put my stuff. First thing I'm gonna do is I'm going to hang the bag. There we go. Alright, and open my tubing. I don't need to be wearing gloves with this. I would usually do this in the med room, but just because it's set up like this, I'll do it in the patient's room. But I will be wearing gloves for when I switch the line, do the saline flush, and all of that. So first thing I want to do is just really making sure that I'm not touching the ends, even though they are capped. And I'm going to put on the roller clamp so that my line doesn't fill up with fluid right away. This is important to remain sterile here, but I'm going to pull that off. Just going to pop it on the table, and then we're going to pull that off. These parts need to remain sterile, and we're going to push them right into there. So now I've spiked the bag. When I do this, I would like to have a pen, and I'm going to slowly, it's still sterile, not the best, but that's okay. We're going to slowly, first we're going to fill this. So we're going to fill the drip chamber about halfway, so you can still see drips coming down, about that. I'm going to slowly open the roller clamp, just to see liquid starting to move down the line. Making sure that there's no bubbles or anything. I'm going to just hang the end of the line here. Make sure it's not touching anything. Priming the line, making sure
getting back to where we are.
Get all these little buggers out, all those bubbles.
And the next thing I would need to do is create a label for it.
Alright, bubbles, let's go. Alright, so I'm going to slowly open the flap again. Inverting this cord again to get all those bubbles out. Oh boy. Using the top of my pencil.
This done is yours.
Come on.
Medication is
seeing if it's dripping.
2 milligrams morphine, 40 milligrams of Granol. It is 11:35 in the morning.
See if it's dripping slowly. This bubble is really to be below gravity, which is a thing, but I wasn't doing there. So I don't know why I was going so slow. Seeing if it's going past.
So now,
And like ideally, I would want to be doing this
I'm gonna wear gloves
over a
for this
sink
one,
where I have it taped.
making sure that I'm
I would prefer to do this over there, but
things are
it
on
was all
technique.
caught up. So
So
this is what we're doing. But really making sure that the end is not touching anything, because microbes can actually travel through the water if it's touching the side of a sink or a garbage can, let's say, and that's not really ideal.
Three places that you would like to administer an IM injection. So the first is the deltoid, which since this is a 12-year-old client and he's quite young, he's not old at all.
So just making sure all those bubbles are coming out,
Demonstrate on myself.
and now I'm going to lock it.
Put your top finger at the bottom of your
Once it's locked, I'm going to do a whole check. So looking through the IV
in the middle of the
from
shoulder.
top to bottom
There is deltoid.
for any
Which is not
bubbles.
ideal for most for some injections, seeing as it's about a 1 milligram limit to the volume that you can inject in that
There's a
muscle
few
tissue.
bubbles here.
And
So
often with children it's
just
undeveloped.
clicking.
So
And another thing to do is just quickly open this and move it up just to see if there's none under the roller clamp.
ventrogluteal,
There seems to be
which
a few
you landmark.
tiny
Which you
bubbles under
landmark by
there.
placing the palm of your hand
Going
on
down
the
further,
cranial
there is
trochanter,
a little bubble in
and
there.
then you point
So we're going to open the roller clamp.
your index finger towards the groin, your thumb towards the groin, your index finger to the anterior portion of the iliac crest, and you're going to spread your fingers, your middle finger, and then you'll be going inside that triangular area.
Just bringing those bubbles all the way up.
That spot for this one. I'm logic going to the
And
vastus
that's on the
lateralis,
floor.
which is right on the outside, on lateral side of the thigh. It's a very large
Alright.
muscle and it's good for taking larger amounts of fluid.
Bringing all those mini bubbles up.
Medication, I should say. So, I don't know if I demonstrated that well enough.
And really the reason we don't want bubbles is so we don't get bubbles into the client, because it is really dangerous and we don't want to cause an embolism. Obviously these are too small, and like you can have max of 1 inch of bubbles in your line, but it's just good to, you know, best practice to not. Jocelyn, could you check my line please?
So prior to administering this medication, because it is a high alert and because it does have medical nursing implications and medical implications such as respiratory depression and drops in heart and blood pressure that can be very detrimental. It can cause death even. But some assessments that I would do prior to this is monitor their level of consciousness, their respirations, and their blood pressure.
Thank you.
And then I would continue to monitor.
Alright, so now that I've got it checked,
To make sure that this
I'm going to
is happening.
do a patency check on an IV assessment, and I'm just going to pop this label on here quickly before I do any of that,
Which I've done
just so we know when to take that off.
comparing the mods
As I've already done, checking the patient's identification
that I'm holding
and
So,
yeah, just explaining what I'm going to do. I'm going to clean my hands and put on my gloves.
the right
I'm not necessarily coming into contact with bodily fluids, but I think it just feels a bit better to have the gloves on.
so the right
So,
route, documentation,
doing that.
the right medication.
And yeah, I'll just set up the pump after I've done this. So what I do is I might just reuse this tape.
So I'll make sure to complete all of those things as we go, make sure the 3 of them. So now the third and
Just
part
untaping the IV.
important
And first I want to just do an assessment of the site. So I'm looking at it, I will palpate lightly for pain, just asking the client if that's uncomfortable, looking for red streaks up and down the vein, which could indicate phlebitis, which can even sometimes get kind of hard like a cord, looking for cool swelling that I could kind of refract light through, which would indicate phlebitis, or sorry, not phlebitis, infiltration, and also looking for redness around the whole site, more in a circular manner, and purulent exudate, which would indicate infection. I'm not seeing anything right now. It looks good. I actually can't see the cannula entrance, but usually you can. So I'm going to continue with my patency check and saline flush. So this is the saline flush, and it's important to remove the bubble and open that.
for about 10, 15 seconds, making sure that it's all.
We really don't want to touch the end of the plunger either because that part is going into the syringe when I do the saline flush, so it's important to kind of keep that really clean. We're going to unlock it and just cleaning really well all the little crevices for about 30 seconds. Getting in the top there and then letting that dry completely. While I let that dry, I'm going to make sure it's not touching anything again. I'm going to take off the cap, and this is the point where you want to not spray the patient, but also get rid of that air bubble in the saline flush. Oh. Alright. Jocelyn? Do you need...
Careful about the comfort and the comfort level and everything. Some of the nursing implications will be monitoring patients.
Do you just need to check that I got the bubble out of my saline flush or no?
I don't need to, but thank you for joining.
I did?
Yes, excellent.
Okay, great.
Various different methods of taking their mind off it.
Alright, so...
Or distracting the conversation, or
Just see that
having
there's a
them watch
bubble in there, so
elsewhere.
we're gonna get that
Being
out.
honest that it might hurt a little bit. so
Even
it's
though
not alarming.
I thought I got it out.
So, with IM injections, you want to go vertically. So I would pull and go
There we go.
quickly,
Alright, and now I have to clean it again.
slowly, but consistently, making sure I don't take too long. But at the same time, being aware that these things can be painful.
Because I did take it off. Normally that would not
Let go.
be the best way to do it,
Or,
but
sorry, I'll
we
leave
do want
there
it to
for
remain
a moment,
sterile, so
making
that
sure
is the
that's
most
not
important thing.
rebounding out.
Letting that dry once again, and now we're going to attach it for the first patency check.
Making sure that you're not
So we're going to do 1 to 2 mils, slowly,
into the sharps container.
yeah. Feeling for resistance,
We have the option of
swelling, if there's any pain for the
taking
client.
gauze over the wound as well, which is not
Alright, and then doing
so
3 to 5 of a turbulent flush. So going all the way down to 3 mils, and then just disconnecting that. That's the first saline flush and patency check.
which is very important, is to take the remainders of the morphine that
Alright, now we're going to set up this line here. So
and making sure that you go back and
we're
get
going
a
to
fellow
use the
RN
pump this time.
or a fellow registered nurse
So
to
we're just going to
witness you
use this guy, and we're going to clamp the line. Oh, let me just get this one backwards. And open this. So it's going to prompt us to pop these in. It's going to give me an okay to close the door, which I will do. Now I'm going to open the roller clamp fully and unclamp the line. I'm going to go to med-surg. I'm going to go to IV. And just go to IV fluid, so 3 down. Okay?
So,
Now I'm going to double check my rate here. So just checking, I do have the right solution again, right concentration, 500 milliliters, and we're going to go 125 milliliters per hour. So we're going to do 125 as the rate, and that's okay. Then the volume to be infused is 500. Okay, and the time will be 4 hours, so that's good. And I'll start the pump once I connect it to the IV line. So at this point, I want to clean the end of the port again. Every time I connect something new, I do want to clean the port, so it's really important that I do this, and just really getting into all those crevices again and letting it dry fully before I connect it. Then this part also must remain sterile, so I'm just gonna see, pulling that off, making sure that's not touching anything, and pushing that into the saline lock, and then locking it just like that. I'll just retape this onto the client's arm so it's not pulling on the cannula. It can be quite uncomfortable, and yeah, just not very conducive for a good infusion. Making sure that's unlocked, and then I'm gonna run the pump. So making sure all the clamps are unlocked, making sure I'm seeing drips, and then also just verifying that primary is infusing, making sure the patient's comfortable, and just letting them know that it'll be about 5 hours. So just calling me whenever, making sure their bed's down and that they're safe, and I'm going to be leaving the room.
Oh no. My phone shut off right now. Oh my god. Jocelyn, my phone shut off 8 seconds.
8 seconds.
I got a phone call.
Okay. Did it,
Or a text or
so it taped and then it stopped?
yeah, 5 seconds.
Okay. Are you able to start letting the go from there?
Actually, that's literally starting it and walking to the other side of the bed.
For which
For the one I just did. The injection.
Yeah, just double check that it didn't record, because it should have just stopped it and saved it somewhere.
Alright, so now this has been infusing for however long. 4 hours, we're gonna say. We're gonna say it's been infusing for 4 hours, and that has been completely, the bag has completely gone to the client. I would have done all my documentation at that point already, but just for the sake of time, I'm going to finish this infusion, stop it, and then I'm going to do my documentation after. So I have washed my hands, I have my gloves on, and I'm bringing in another saline flush, because whenever we discontinue something, we're also just checking that the IV is patent. And I'm bringing in a little blue cap because it is important to keep that primary line sterile. This primary line, because it's intermittent, it will only be valid for 24 hours. So tomorrow, as I wrote on here, at 11:30, because I started at 11:30, it will be invalid, or it needs to be replaced, basically. So I'm going to stop this, and then looking at the client again, when you're doing an IV infusion, and just in general when someone has an IV, you're checking the site every hour. If there's any swelling, for all of those things like phlebitis, infiltration, infection, and bleeding, so any of those things, I would have come back and make sure also that he's not in fluid overload, which could be, you know, he could be getting edema, or there could be crackles in his lungs, because his lungs could be getting fluid in them. So those are things I would be checking for intermittently throughout the infusion. Oh. So now this little blue cap, I'm going to want it to not touch that end. So you want to be really careful. So discontinuing that and then pulling it off. So that's okay, that doesn't need to remain sterile because I will clean it every time I use it, but just making sure that little blue cap is on there, and then just hanging it like so by the patient's bed, so that if he needs some more fluid within that 24 hours, there is a line ready to go that is sterile. This time we're going to do this a little bit better. I'm going to get that air bubble out before I start, so just making sure there's no bubbles, and making sure I'm not touching the plunger. I'm going to get to loosen it sometimes, I find. And there we go. Alright. And that cap is sterile, so I could recap it. I might just not cap it and hold it to keep it sterile, but still having to clean that end. So cleaning it really well. The cap. And the alarm is decided to go off. So that's clean. I'm going to let it dry quick and just stop this alarm. Alright, so I'm going to maintain that sterility on both those edges, or those
So we're at an hour.
contacts.
If you could just finish up the skill you're working on. No rush, we can go for by a couple minutes.
I'm going to do 1 to 2 mils of the patency flush, so 1, just feeling for any of that resistance, pain, swelling, and then I'm going to do 3 to 5 mils of turbulent motion, just emptying out anything in that cannula, any medication, which I haven't given, but if any blood was stuck in there, then I would. And then at the end, you want to be doing the positive pressure, so pushing and then clamping it at the same time so there's positive pressure in that saline lock. I'm going to make sure the patient's comfortable, turn off that pump, and I'll be back to check on them in a little while. Washing my hands as I exit the room.